When COVID-19 started making headlines for the way the coronavirus was affecting nursing homes, the positive test numbers were staggering. Now the virus is showing up the same way in prisons, jails, and correctional facilities because of the close proximity of those being held there. But in this week's Our RVA, one group shows us the steps they're taking to try to solve the problem.
As we watched it ravage through nursing homes, we said to the Department of Juvenile Justice and every other facility holding individuals in carceral states, hey, these are spaces that are potential for outbreak.
Valerie Slater is a lawyer and executive director for Rise for Youth, an activism organization dedicated to helping incarcerated young people. Right now, Slater says she's particularly concerned for the youth at the Bonaire Juvenile Correctional Center in Chesterfield, where the state says 29 inmates and 10 staff members have tested positive for the coronavirus since the pandemic began.
We are trying to get out every young person that has satisfied their requirements to the court, they have satisfied their treatment plans, and they have someplace safe within community, even if it means we are helping to provide.
Last month, a letter signed by 8 Commonwealth's attorneys, including Henrico's Shannon Taylor, was sent to Brian Moran, the Virginia Secretary of Public Safety and Homeland Security. In conjunction with Rise for Youth, those prosecutors asked that juveniles who don't pose a public safety threat be released from Bonaire to reduce the risk of infection. Moran tells CBS 6 the state acted quickly to protect those inmates.
We've also taken the extraordinary steps of reviewing all of those kids that have indeterminate sentences. Those are sentences where juvenile corrections actually has authority to reduce those sentences. And they have done that. They reviewed them, and we've reduced the population by about 10%.
The way to do that is for the Department of Juvenile Justice to work not only with judges and Commonwealth attorneys, but with the community that has the resources to help make as many transitions as possible.
Arjane Avula, who lives in Churchill, has an 18-year-old brother currently inside Bonaire. She turned to Rise for Youth after saying her brother fears for his health.
Yes, he did say, he was like, what happens if I get it? I have asthma, I can't, if I get it, that's no good for me.
The Department of Juvenile Justice website has a page for the latest information regarding the coronavirus situation at Bonaire. And while the number of cases are declining, Slater says more should be done to reduce the size of the population at that facility.
Right now, you have too many young people inside Bonaire Juvenile Correctional Center, and it has been a part of the reason why that pandemic has had an opportunity to spread as widely as it has. So bring those numbers down. Accept the help of community because our hand is extended.
We reached out to Valerie Boykin, the director of the Department of Juvenile Justice. She declined to go on camera, but in a statement to CBS 6, she said, quote, when DJJ had its first Bonaire resident test positive, and after consulting with the Virginia Department of Health, the agency instituted a quarantine April 5th to help understand the extent of the virus on the campus and to prevent further spread. The following day, DJJ began screening residents twice a day and any resident who had even a slightly elevated temperature. An aggressive protocol still in place today. Another recommendation from the Virginia Department of Health involved limiting the number of staff and a quarantine of all Bonaire residents. This and other social distancing measures, as well as providing all residents with multiple protective masks and having the desired effect. There have only been 2 additional positive tests in the last 2 weeks. The quarantine has been relaxed as the number of positive tests dropped.